This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, wow, I said that fast, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm doing very well today, Amy. Thank you very much.
Good. Nils told us this was episode 102, and I kind of thought to myself, like, is that the episode number or the temperature out? Because
I know, it feels very hot.
We are sweltering.
If you're in the West,
Whew.
It's hot.
It's toasty.
Yeah.
Yes. So the episode today, we're going to be talking about liposuction, which is an interesting topic that
Have we not talked about liposuction through 100 episodes?
Well, we have. We've talked about it a lot, but we've never talked about it, like given it its own episode.
Like a standalone?
Mm-hmm. So if you want to
So
watch...
liposuction is kind of like the redheaded stepchild of plastic surgery.
I take offense to the redheaded comment, but yes. If you'd like to watch the slides that go along with this podcast,
I'm sorry.
You can find the slides on our YouTube channel at Jason Martin MD. We really appreciate everyone watching and listening. We have been getting some really positive feedback recently.
Yeah,
and we
crazy
really
traffic.
Appreciate it.
We got crazy traffic on the YouTube channel.
So yeah, the slides for this are not super interesting, but we've got some great before and after pictures, and it's always fun to follow along, right? I like following along.
I do.
Yeah, I like following along.
Yeah.
So yeah, let's talk about liposuction.
All right. We're back at it. Like we're back at plastic surgery stuff. Mm-hmm. You know, we've been on field trips for the past couple episodes.
I've had some fun diversions.
Yeah.
Yes.
Now we're back at it.
Yeah. Back to the
very important information.
I was going to say to like the meat of it, but it's to the fat of it.
The fat of it.
Yes. Getting in there. There's a lot of good fat, like, right? Like,
oh, there's so many fat jokes.
Right? Well, they're not.
I mean, okay, not fat shaming jokes. I'm just saying like fat. Yeah,
wait, not your mama's so fat.
Yeah, exactly.
She doesn't sit around the house.
Your mama's so fat she uses the driveway for her ironing board. That kind of stuff.
that kind of stuff.
Yeah, that was in 6th grade.
Yes. So we had a great episode, a couple of years ago, I would think at this point, where it was called Let's Talk About Fat. And we talked more about like the functions of fat in the body and a little touched on fat transfer and some other stuff. But I was surprised to look back through our catalog and see that we had never done an episode specifically about liposuction. We've talked a lot about assisted liposuction and other liposuction
Yeah, we've talked
surgeries.
About body tight. We've talked about different types of energy assisted liposuction, but we've never talked about liposuction alone. Liposuction itself is one of the most common procedures we do in plastic surgery.
I have the stats for that in just a moment.
Cool. I'm jumping ahead like I always do.
I know.
It would make sense that I would look at the slides beforehand, but no. I'm a professional. You just bring it up and I talk.
That's right.
Yeah.
So let's first, like we said, we've talked about a lot of other things in the past, but let's define what liposuction really is, because people still ask me this. Like,
so
what is liposuction?
Amy, let me ask you, what is liposuction?
Well, the kind of dictionary definition of liposuction is the removal of fat from beneath the skin using hollow cannulas with the assistance of a powerful vacuum.
Oh, that sounds very menacing.
Yeah, which it is. We suck the fat out. I mean, it seems simple, but that's what liposuction is. We suck the fat out. It's
funny when you talk to some people about it. They're like, okay, so what are you really doing? I'm like, literally, we're hooking up a vacuum and sucking fat out. And they're like, but what are you really doing?
Like, that's it.
Yeah,
we got a hollow cannula and the fat's coming out.
Right.
Yes. So on a very basic level, that is liposuction.
And if you're looking on the YouTube channel, the slide shown is actually injection of the tumescent fluid. It's not liposuction itself.
I know.
I'm just splitting hairs. I'll talk to Sarah about that later.
You have to numb it up first. So let's now get into what Dr. Martin was touching on. I called this slide, the war on fat.
There's a lot of information here.
Yes. Yeah. But it's a really common procedure. I mean, here are the numbers here, and the change from 2000 to 2020, I found amazing that it actually went down.
Really?
Yes.
Huh.
Yeah. So I think a lot of that, though, is because people are doing other types of treatments also and or instead. less invasive, things like M-Sculpt, things like Cool Sculpting.
Yeah.
Trying other things first.
Right. Cryolipolysis, external treatments that don't work, but that's fine.
Yeah. And again, I mean, I think we'll see this number go back up. I mean, if you look, I think the real difference here was kind of in the numbers that we saw a big drop between 2019 and 2020. Not so much that there's been a huge drop since 2000.
Gotcha.
It was a shorter term. It was just happened to be a really large drop in 1 year. And I think that's more a result of the other technologies that have come on the market. But at the end of the day, and this is what I always tell people, is external things are great. But when we do liposuction, I throw your fat in the trash when we're done. So I know it's gone.
Oh, yeah. It's definitive.
We are not like...
It's in a red bag and it goes to a medical waste company.
Like your fat is gone forever.
Or if you're in Fight Club, it goes to make soap.
That's right.
Yeah.
I make soap. So yeah, your fat goes away forever with liposuction. It is suctioned out. It is solidified. It is medical waste. It is gone for good. If you do an external treatment, maybe.
Yeah, we'll see.
Yeah.
Yeah. Hey, we'll see.
Yeah. So I was...
You got to wait a couple months and we'll see how it goes.
Right. Let's see what happens.
Yeah.
I was actually not going to put anything on this slide.
No. I actually thought of this. So when you gave me the topic,
Yep.
I really wanted to talk about the history of liposuction. It's very interesting.
Fascinating.
Yeah.
Yeah.
And Aluz, who's a French, do you have that on there?
I do.
Oh my God,
The
I
Frenchman.
love you. I absolutely
He's on
love
there.
you. He's a French surgeon, 1978. Isn't that nuts?
Yeah.
It was started in Europe.
There he is. Elise.
Yeah. And it was developed by this gynecologist who was, I think, Italian. Is it
He was
Italian?
Italian.
Yeah. Well, look at
Giorgio
this.
Fischer.
Yeah, good job.
Yep. 1974,
And
Giorgio Fischer.
Luz kind of perfected it, this French surgeon, and then it came to the United States in the 80s. And it was disastrous at first. Like people would get very sick. They had people die. This was the old days.
Well, they were doing dry liposuction. That was
With
a big problem.
Yeah, with no tumescent fluid, no epinephrine, and we'll talk about that, I'm sure, in a second.
Which sounds terrifying.
Yeah.
I mean, that's really where, kind of going back, I mean, obviously we've been removing fat since before this time. I mean, what episode do we talk about when they would do like big, massive excisions of fat? There was maybe it was when we on our episode, Let's Talk About Fat, like
Yeah,
where they
probably.
would just cut out, they tried just like cutting out big swaths of fat.
Yeah.
For treating obesity and other things like way back in times. But really in the 70s is when liposuction as we know it
Started.
Yep, with the hollow cannulas.
And it came to the United States in the 80s, and actually the mid 80s. This is a dermatologist named Dr. Klein. Shout out to Dr.
Jeffrey Klein.
You got it all here.
Yeah.
You don't even need me. Just go on the YouTube channel. This is amazing. You got it all here. We didn't even talk about it. So Dr. Klein, California dermatologist, was actually there was another dermatologist in Colorado actually that worked with him. They came up with some techniques. And then the guy who taught me, Jerry Pittman, Pitman, he on the plastic surgery side really, it started to grow in the mid and late 80s. And you see this burgeoning field of lipocontouring. And that's where liposuction came from.
Yeah.
And there's not many cosmetic surgeries that have that lineage, right?
No.
That started in the 80s and became popular in the 90s. I mean, think about it, like a whole part of a whole part of plastic surgery.
Yeah.
I mean, like a procedure or a different type of approach, but this was all
hundreds
brand
of
new.
thousands of people a year get liposuction in this country alone.
Right.
So, I mean,
that started less than 30 years ago.
yeah. Well,
So-
more than almost over 40 years ago.
Well, no, I mean, in the United States, it became popularized in the
Yeah.
90s. So,
Yeah.
less than 30 years ago, which is pretty crazy.
Yeah. So a few of the really interesting things I think you touched on is initially, when these French and Italian guys were doing cannula liposuction, they were using extremely large cannulas. The dimensions were massive. The biggest issue with those, and that's why lipo had a really bad rap in the 80s, was because patients were having terrible issues with inflammation. They'd have extreme bleeding.
Yeah, real bad bleeding problems. And then they would have contour problems, healing problems, and subdermal scar tissue. Yeah.
Yeah, like really. So lipo was, everybody wanted it to be great,
It was Wild West at
but
that
it was
time.
definitely not. Yeah. So
We're kind of in the wrong era. Like now, the fact that they just kind of did what they wanted.
they did, surprisingly
It's
enough.
just totally different.
How do you consent somebody for that?
I'm not sure. Like, we're not really sure how this is going to turn out. We got like a very large cannula that we're going to stick underneath your skin. And we're kind of thinking this is going to be pretty good, but yeah, it's kind of touch and go.
Yeah. And again, we did a great episode where we were talking about skin, and I had a good diagram of like the layers of the skin, the subcutaneous layer, the fat, the blood vessels. And when you think about it, like our skin is extremely tactile. So we have a lot of like nerve endings and blood vessels, obviously, that come to the very, very, very surface of our skin.
And they do that for heat regulation primarily.
Yeah.
Yeah.
You start just shoving a cannula underneath there and you're disrupting a lot of stuff.
Oh, yeah.
So you think if you're doing what we call dry liposuction, so they weren't using a lot of infiltration or numbing medication, no epinephrine, you're just in there like sucking stuff out with a giant straw at the time. It was pretty brutal.
Yeah.
I mean, like,
I have to admit, now I'm totally scared. I don't ever want to do liposuction again, having this conversation.
you just got done doing a huge lipo case.
I know. I just did a huge lipo case. Like, what was I doing? This is so scary.
Well, that's where the Klein, and we still call it Klein's solution. So the tumescent that we use, we call Klein's solution. Right. So it was the specific type of...
Right. Dr. Klein and Pittman and all these people start to realize that you can improve the safety profile of liposuction if you use something called tumescent fluid, which is saline mixed with lidocaine, and you add epinephrine. So, Amy, what does epinephrine do?
It's blood it constricts.
Vasoconstriction. So vaso means blood vessel. Constriction means gets tighter and smaller. And so all those little teeny blood vessels that would bleed, you give epinephrine beforehand, they have a tendency to clamp down and they don't bleed when you do liposuction. It completely changed the game.
Yeah. And it can be done awake.
Be done awake.
Also safer.
And which is funny because liposuction was done awake at first, and then everyone started going to sleep because in America everyone always more is better. And then about 2000 things started to go awake again, and then our kind of practice is newer style practice. We do a majority of our liposuction cases awake, not asleep. Now, we'll get through what the limitations are on that, but it's really interesting to look at this history. There's very few histories in plastic surgery that have like one tree branch lineage. Mm-hmm. It came from this one dude in France, started with his gynecologist in Italy, and then migrated over to America, and things went cray-cray at that point. So that's cool.
Well, the other thing too that the Dr. Klein really started doing was a lot smaller cannulas. Yeah, obviously to allow for awake procedures as well. And we have some.
It's hard for the plastic surgeons to give a shout out to a dermatologist, but hey, Klein, shout out.
It, yeah. And we have larger cannulas here, and I call them the mean cannulas because even though you're numb, I mean, as the patient, you can definitely tell the difference between a very aggressive large cannula. And I wish I'd brought some in here, but they're all actually in use and or being cleaned at the moment.
Yeah, we just used
them all to show you the difference. I mean, some of them are really small though. I mean, we've got this always comes in handy. The body tight cannula here, if you're watching the video, you can kind of see it's pretty small. It's pretty small. And this is about the size of some of the small liposuction cannulas, but they go up in size from there. I mean, the large ones are quite a bit bigger. And they can be even when you're numb, like you're still going to feel that difference. So smaller cannulas, being awake, all these things made liposuction so much safer. There wasn't the fear of excessive bleeding.
Yeah. So the take home, and no one likes history. I love history. The take home is it's a lot safer now, but it started on shaky ground.
Yeah.
And things changed over time. And that's what, to me, makes it so awesome. You just, like, over time, we started to learn and we figured out different ways. Innovation from, like, singular people, like, which was awesome,
you can trace it. Yeah, it is very cool.
All right.
So let's talk about the types of liposuction. We kind of hinted at it, but now the commonly used types of liposuction, we're going to call tumescent, modified tumescent, and then energy assisted. Tumescent being local anesthesia only. So you're awake, you just have local anesthesia. Modified tumescent is going to be your local anesthesia.
Are these actually the real names for it?
They are.
Okay.
Yeah.
Because I don't ever say modified tumescent.
That's the technical term for it.
So is that what people say?
Yeah.
I hate medicine.
Modified tumescent is...
It's like a liposuction when you're asleep or like a liposuction when you're awake.
But
that's what like a normal layperson would say.
It is, but there's a different concentration of Klein's solution for awake versus asleep liposuction.
All right.
So in modified tumescent liposuction, you're using half the amount of lidocaine per 1,000 cc bag.
Right. And that's not standardized, but most people use. Yeah, gotcha.
I would say on average, that's kind of the thing. And you're sedated. So there are definitely benefits of having sedation with liposuction, primarily being that you can have more areas done.
Yep.
The doctor can be more aggressive because you are asleep. And we're not trying to torture people here. So you're comfortable, you have more areas treated.
But my joke when people are awake and they have discomfort, I always tell them that I'm not in pain, so don't worry.
It doesn't hurt me. Or that I'm doing it.
That's really a mean joke, isn't it?
Amy's doing this. That's why it hurts.
All right, I'd say when Amy's in there.
Yeah.
So let's talk about tumescent fluid real quick. Or do we have a slide on that?
Nope.
Okay, good. So tumescent fluid. Amy, what is tumescent fluid? I know I said it before. Let's go over that again.
Yeah. So standard tumescent for awake procedures for our office is going to be saline.
Okay.
It's a normal saline.
Gotcha.
Bicarbonate.
And by the way, that's the saline that you put for IV fluids.
It's actually a little different. It's not lactated ringer.
Well, whatever. You can do normal saline. 0.9. You can do it. If you're going to the hospital and you're dehydrated and you get fluids that go into your IV, that's the same type of fluid that you would put in there.
Yeah. There is some mild argument when there was a shortage of normal saline that There was a specific thing you had to adjust for LR bags if you were using LR bags, lactated ringer bags for lipo.
Why are we even talking about this?
Because you asked me about tumescent.
Do you think anyone on the podcast or YouTube channels care about this?
Yes.
No.
So standard tumescent is going to be saline of some sort.
Right. So it's saline. Go ahead.
Lidocaine.
Lidocaine. Everyone knows lidocaine. Lidocaine is what you get to numb things up. When you go to the dentist and they inject that stuff, that's lidocaine, right? When you go to the dermatologist and they do the hack job on your skin, that's lidocaine. Lidocaine affects the nerves themselves, the sodium channels, sodium-potassium channels. It stops those from working, and an action potential, which is like the electrical pulse that goes along your nerves, cannot propagate. It can't move forward, and that's how local anesthesia works. And to be honest with you,
pretty crazy.
It's pretty crazy.
Yeah.
I know, it's totally nuts.
Yeah, I say this all the time. Like, it is amazing what you can do to an awake person with lidocaine.
Right. And you can completely numb your nerves. You feel nothing. And if you've ever had that sensation where it feels like wood, you still have some pressure sensation. Like if you press on it, you know someone's touching you, but you don't
moving you.
Yeah.
Yeah.
Or proprioception things too. But in terms of actual discomfort, you don't feel it, which is nuts.
Yeah, it's pretty crazy.
What else is in there?
Epinephrine.
Epinephrine is a vasoconstrictor, which we talked about before.
Yep. And for awake procedures, we add sodium bicarbonate.
And why do we add that?
It makes it more pH neutral so it doesn't sting. So lidocaine is very acidic.
Yeah.
So that's why, like, when you do go to the dentist or go to the dermatologist, that initial injection they give you hurts.
It burns. You know what they could do? Yeah. They could just add bicarb, but they won't.
A little bit of bicarb. We don't either.
Because they tell you to suck it up,
yes.
And that's what we do too.
Yeah. So that keeps it from burning, and that just makes the tumescent process more comfortable. Because it does feel weird to have someone, sticking even a little tiny cannula under your skin and filling you up with fluid feels a little weird.
Right. So when you take tumescent fluid, everyone has an upper limit of lidocaine that you can inject. So Amy, why is it important to stay within a safe range of injection of lidocaine in the soft tissue? So that's underneath the skin, but not in the blood vessel itself. That's a different equation.
Totally different. Very important for the reasons that you described of its effect on the nerves. So if you think about it, you're putting a lot of lidocaine in. This is having a systemic effect. It's being circulated. Yep. If you over-inject someone with lidocaine, even into soft tissue, the effects can travel. And you don't want it traveling to places like the heart.
Right. Or your brain.
Yeah.
And that can cause seizures. It can have severe heart arrhythmias. And people have died. Historically, people have died. And that's very rare. But something called lidocaine toxicity is a real emergency.
Yeah.
So
not something you even want to flirt with.
Right. Therefore, if you're trying to do an awake procedure in the office, which we do every week, we just did a big one, and you want to do a lot of areas, you're limited by the amount of lidocaine that you can use. And so the number of areas you can do awake are really dependent on your weight. If you're a bigger person, of reasonable weight, but or reasonable body fat percentage, but a bigger person, you can use more lidocaine than a smaller person that weighs less. Okay. And that's very important for people to understand. Some people come in and they just don't want to go to the operating room. They don't want general anesthesia, and they want to do 12 different areas on their bodies. And you have to basically scope it down to the safe number of areas. An office like ours can tell you right away how many areas you can do. But, that lidocaine toxicity is really one of the few things that, is of note with liposuction in terms of safety. Modified tumescent, when we go to the operating room and you're asleep, even though your brain senses pain, it doesn't wake you up, right? Because you're sedated. So we still
numb it.
We still give lidocaine to help the anesthesiologist keep you asleep, to make sure your body physiology is not out of whack because it's sensing pain, but you're asleep and you can't wake up. But we use half the amount of lidocaine per bag of saline. Therefore, we can do more areas of liposuction safely in the operating room, almost an infinite number. But you can reach the max there too. And the last thing she put on this slide, if you look on the YouTube channel, is energy assisted. Now that's where liposuction has changed in the past 10 years. And if you want any representation of the change in liposuction, just look at our practice, because we do energy assisted liposuction, Vaser, Smart Lipo, now we're doing Body Type, and even Beautiful. All these things have energy assistance. So you treat the fat beforehand with some sort of energy underneath the skin, not above. Radio frequency, laser, ultrasound, energy, et cetera, melt the fat, tighten the skin, and suck it out at the same time. So that's the types of liposuction.
Yeah, and there is still, as you hinted at, there is still very much an upper limit of what's safe for liposuction, whether it's in the office or in the operating room.
How many liters of removal of liposuction aspirate? What's the layperson term for aspirate?
Aspirate? Oh, how much you take out?
I don't know.
Yeah.
The stuff that's sucked out.
Yes. How much
How
comes
many
out?
liters of the stuff that's sucked out
fat.
is safe until you have to be hospitalized with IV fluids?
Nils, you want to guess?
How many liters? Come on, Nils. You're pretty much a plastic surgeon now. You've done 100 episodes.
Just throw out a number.
I always get it wrong, though. It's like liters.
Mm-hmm.
2?
Okay, Nils.
No. So it's 6.
It's actually 5, I think.
Well, but 6 is where the real hard cutoff
Oh, yeah,
is.
yeah. So 5 for sure.
Yeah.
At least that's the way I was. Yeah,
Yeah,
5
6.
liters. So imagine 2-liter Coke bottle times 2.5. And that's like the limit where you have to be hospitalized and get IV fluids after surgery.
Yeah, so you have to think about it when you're taking out like the fat, like you're calling it the aspirate. There's more than just what you put in coming out, and that what's coming out is fat, but it's also interstitial fluid. It's a little bit of blood. It's all that stuff. So if you're doing more than 6 liters of volume, and I'm sure there are absolutely doctors out there who put all over their social media that they're taking out 10 liters at a time.
That's insane. But
you need to be in the hospital to do that. Yeah, like. That's a hospital procedure for sure.
And then when you rough up underneath the skin, it causes something called third spacing. That's where you get this fluid comes out of the blood vessels and into the soft tissue.
It's damage.
And that causes hypotension, et cetera, low blood pressure. So you just need to watch that. Yeah,
and injury's injury. Your body doesn't know the difference. So that much liposuction, it's pretty traumatic to the body. Ask anyone who's had any liposuction, they'll tell you it's traumatic. All right, so let's talk about who is and who is not a candidate, because I think this is a really important distinction that there is still some thought that liposuction is only for fat people, which is not true, or that liposuction is a weight loss procedure, which is also not true. So candidate is pretty easy. Men and women over the age of 18, healthy, stable body weight.
Right. It doesn't mean you have to be super skinny, but it's like a body weight that you can maintain that's not unhealthy, usually with a BMI less than 30.
Yep. And without uncontrolled medical issues. So regardless of your size.
Diabetes, high blood pressure, if you're on steroids for rheumatoid arthritis, there's the litany of things that you can look at. You got to do it right. You got to be safe.
Yeah. You still have to be healthy enough for surgery of any kind. So, and not on, medications that thin your blood or all those other things.
Who is not a candidate? That's the real question.
Yeah. And like I said, that's where I feel like there's a little more confusion. So I've written out just a couple of things. So someone who is more than 20 pounds over a healthy or maintainable body weight. So like I said, it's not weight loss. As we mentioned, 6 liters is the maximum amount that can be taken out. And even though that sounds like a lot, fat is pretty dense when you think about it. So that it's not for weight loss. Someone who is underweight, so a BMI of under 18, is absolutely not a candidate for liposuction. Uncontrolled or untreated medical conditions, again, not a candidate.
Okay. That's fair.
That's fair.
Yeah.
Yeah. And, I think I don't want to discourage anyone from getting liposuction if you feel like you are overweight. For you, it's still worth getting a consultation with someone and seeing where you're at. You might be a candidate, you might not. If you're more than 20 pounds over a weight that is healthy for you, then you might want to get closer to that level.
Right.
But there's
nothing wrong with like making it a goal, losing the weight you need to lose and kind of getting there.
Yeah.
And when we're saying 20 pounds over your healthy or maintainable body weight, doesn't mean that you have to be at the ideal weight.
Yeah.
Most people run at a certain range and that's where they are. Mm-hmm. As long as you're healthy and you exercise, you eat right.
And your weight's been stable.
And you can prove that, then that's totally reasonable. There's no reason to do surgery if you're not going to maintain it.
Yeah.
Let's say this differently. Liposuction is not a weight loss method, okay? People that use liposuction for that, they will be disappointed.
Yeah. Yep.
Okay. So liposuction is a way to contour areas of your body that either for hormonal reasons, age reasons, genetic reasons, or carry a disproportionate accumulation of fat underneath the skin that will not go away with diet and exercise.
Yeah.
Basically, that's what it's made for.
Go ahead.
Go ahead.
No, just one of our pictures that's coming up is a great example of someone who just had a very odd distribution of fat. Very athletic person.
All the time.
Yeah.
the pear, the apple, whatever, you see this all the time. And liposuction can make a big difference.
Yeah.
And by the way, liposuction primarily is for how you look in clothes, even though we aspire to show people like, exposure of their torso and stuff after liposuction. It's really about clothing and feeling good about how your body contour looks in the mirror.
Yeah, and balance. Yeah. So areas treated. I almost put like everything.
This is like mommy makeover.
Yes.
Like it could be everything.
Yeah, any area with excess
with fat. I mean, I think we made a joke one time that the only area I can't think of that you could liposuction is your earlobes.
I think you probably could.
And you were like, I think we can.
Yeah. I said we could accutite them.
Oh, we could definitely accutite the earlobes.
them. So I just started kind of from the top down. So your chin, your neck, bra line or back fat, arms, flanks, your whole back, abdomen, inner outer thighs, knees, any area with excess fat.
Oh, you forgot the breast.
Bra line, back fat. I mean, we don't do a lot of liposuction on the breast itself.
Gynecomastia.
For gynecomastia,
male breast,
yes.
Sarah, male breast.
For chest, yeah.
Chest.
Chest. Calves. I mean, we've definitely lipoed calves, like women who just have heavy calves.
Inside the knees.
Yep.
Those medial knees inside the knees.
Mm-hmm.
Saddlebags, inner thighs, flanks, or that spare tire around your waist. Upper abdomen, lower abdomen, bra line, arms.
Did you read my list?
I'm just thinking from my head. Amy.
It's my list.
I'm just
Buffalo
basic-
hump.
Well, buffalo hump.
Yeah, areas I didn't mention.
The upper back,
Yep.
below the neck, the buffalo hump. And it's literally called buffalo hump.
It is. That's or dowager's hump.
There is no part of medicine that's really nice, I mean, this poor woman suffering from a buffalo hump because she has like, it's usually associated with
PCOS.
PCOS,
Yeah.
thank you.
But it's genetic too. Your mons, like on a man, like your fupa, like that really technical medical term. Fupa.
Yeah, I think the slang terms are worse than the
We're gonna
medical
get
terms.
kicked
The
off of
fupa.
YouTube for
Yeah.
that.
Is fupa a bad word?
Well, I don't think it's a great word.
Okay.
Yeah.
Did YouTube kick you off for bad words?
No.
Okay.
We're
We're okay.
adult.
We're over
We don't have a lot
18.
of kids listen.
That's right.
All right.
All right. Well,
That would be hilarious if we got kicked off for using that slang terminology that every patient says to us in the office.
Yeah, right.
Like literally. Sorry.
Yes.
Okay.
All right. Well, on that happy note, let's take a quick break. We're going to
Sorry,
listen to a word
YouTube.
from our sponsor. Let's get checked.
Let's get checked.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast. Let's get checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically, you're saying we're very choosy.
We're very choosy
Yeah.
when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah, and Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
Yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
All right, we're back.
We are back.
18 and over only, please.
Yeah, exactly.
All right. So let's talk about downtime and recovery. Liposuction, as I always tell people, it hurts. Like it does. It hurts.
Yeah. It's one of the most painful things we do.
Yeah. And it's going to hurt for longer than you expect and more than you expect. Right. and what in our recovery expectation episodes, we talk specifically about liposuction. One of my slides, I put swelling, more swelling, more swelling.
Right.
Even more swelling.
Which was the answering the patient responses or questions or the voicemails?
No, it was recover. Oh,
the one where she talks about
swell
health
from tummy tucks.
That's still stuck in my head.
Swell health
from that patient.
Yeah.
You kind of have swell health too.
You do. I mean, so truthfully though, like starting at the top, the downtime recovery is absolutely going to be based on the location, the amount of and the type of liposuction, and just the number of areas that you had.
And your general
liposuction on.
Physiology too.
That too. I mean, that's with any procedure. Who you are is going to be the biggest factor.
By the way, smoking is terrible for recovery. Thank you.
Yeah, don't smoke for recovery. So some areas of liposuction tend to be more painful. Mm-hmm. So the back, it tends to be more painful than the abdomen. Just is. Mm-hmm. The neck tends not to be very painful. The
inner
arms,
thighs hurts when you go to the bathroom and sit on the toilet.
4 weeks.
Yeah, for weeks.
Yeah, but like areas like the knees or the chin, like you might not have any pain. I mean, you might have very minimal discomfort with some areas, whereas other areas of liposuction will cause discomfort for long periods of time. So
we do face type procedures, which are liposuction of the neck below your chin, the turkey gobbler people don't like, that extra area of fat, the selfie fat.
Selfie fat.
And then we do the face tight at the same time. And some of those patients come back a week later and they don't feel anything.
Yeah, have really no discomfort. Same thing, like I said, like little areas like the knees, even the abdomen on some patients. Like, it doesn't really hurt.
Yeah, so it really kind of depends.
Yeah, but you definitely will have some restrictions. And again, we are not your doctor. Well, maybe we are, but go with what your doctor tells you for exercise restrictions.
I'm starting to think we're a lot of people's doctors.
I think so.
Yeah, because it's got more popular calling us up for our opinion. So
yeah, but 2 to 4 weeks on average of reduced activity or limited exercise is common. Bruising, 2 to 4 weeks, can extend longer. Some people have no bruising at all.
Nope.
Which is always the unicorn who tells all their friends
all
that
their friends,
no
Dr.
bruising.
Martin's best surgeon ever. No bruising, none.
And then their friend is like,
their friend's like, I heard you do no bruising surgery. And I say, absolutely, that's not true. You're not locking me in. I have a wife. I know how this works. You want me to say something right now so you can hold that over my head? Not doing it.
You're going to bruise.
No.
Yeah. Swelling, I put several weeks, 2 months. Because truly, you aren't going to see your final result from liposuction for 6 months. And that process of inflammation, as we talked about in our Swell Hell video, it happens over months. It's not a short-term process. So when people call me up the day after their liposuction and are freaked out because they tell me we didn't take the fat because they're fatter than they were the day before, that's swelling.
We get that all the time.
Yep. I literally had that conversation with someone yesterday.
Why am I more fat?
Yeah. It doesn't look like he did anything. I'm like, oh, how does that feel? You feel like something was done? Because that's going to be the truth. But it takes months for your body to process inflammation, and who you are, going back to physiology, is going to be the biggest factor in this, but what you do for recovery, how to help
Some people swell a lot. If you're a
Yeah.
person that swells, if you eat salt and, like you're always swelling with your cycle or whatever, then you're probably going to swell with liposuction. If
Yeah.
you're a person that does not swell at all, you may not swell with liposuction. It just depends. I mean, people are very different, genetically speaking.
You're going to swell some just because of the injury essentially to the area, but
Right.
the extent is going to be based on you and the length. So it could last a really long time. But in your mind, I would think, like when they say 6 months, like just think 6 months.
Right.
Compression for most offices is going to be 2 to 4 weeks. I have had some patients tell me that their doctor had
So,
them-
Amy, what is compression doing for the patient?
So compression does 2 things. Compression does help moderate inflammation. So it kind of helps keep inflammation from getting out of control in some people. It also is comforting. So it's the same
Right.
reason why you swaddle a baby.
That's the main thing, is the
Yeah.
comfort part of it. People think that compression, like some doctors will tell you, compression is like the way you did, that's the only way you're going to get good results. They're full of crap,
Yeah.
right? Because the way you get good results is do good surgery. Compression
That's
is
the
not
only
going to
way.
make or break the procedure, no matter what they say. Now, you don't want uncontrolled swelling, distortion from the swelling, and the garments can help with that. But don't let someone tell you that compression is going to make or break the surgery.
No, I would question.
If they're doing that, then it feels like they're kind of misleading you on purpose.
Yeah. And, we have patients who have come to us, had surgery with their doctors who made them wear compression for like months at a time. And that used to be going back to the 80s. I mean, the swelling was a huge issue with liposuction in
it
the
was more
early
traumatic,
days.
yeah.
Super traumatic. So yes, they'd make you wear compression for months. I think part of that was just so that you didn't look at the area and freak out
Right.
because it was all disfigured.
That's exactly what it was
and
for.
rippled and looking horrible. Compression has a downside, and the downside is real. So you can overdo it with compression. You can become very lightheaded. You can get really vasovagal when you take your extremely tight compression garment off. Like fainting couches were a thing because of compression.
You said that.
Yes.
They would put fainting couches in the bedroom in the
Yes.
Victorian times.
Because they take their
See,
clothes off and
ladies, you got a
pass
lot
out.
better now.
Yes. And that's still true. I mean, on our instructions for post-op, like
The guys don't really have something like that. I mean, they used to
fainting
wax.
couch?
No, like where they had to wear something that was so uncomfortable. No?
I mean, armor I can't think was super comfortable.
Yeah.
It saved your life, but I can't think a suit of armor was
You had to
comfy.
wax their mustaches. That probably was, kind of tedious.
Oh, like women don't wax their mustaches to this very day?
No, wax, like they, the mustache wax.
Grooming.
Yeah.
Again, like women don't groom their hair every
Yeah.
day.
I was trying to think of a guy thing.
That's worse? I don't know. Well, going back to compression. So on our post-op instructions, it does say that the first time you take your compression garment off, specifically not to do it in your bathroom
Yeah.
standing up, to do it, sit down.
Do it
take
on your, passing out
around
couch.
soft things, yes, near your fainting couch, because it's true. So the other thing that can happen with compression is if your compression is not fitted very well to you or has excessive seams or crazy hooks, those can leave permanent indents as you recover if you never take it off.
Right. What about this whole foam scenario?
Yeah, the boards or foam. Again, if
We've had patients like that. The doctor said that I had to wear foam, that if I didn't wear the foam, everything would be
right,
destroyed.
that they'd have no result. Or even a woman who came in and was wearing a
I've
cutting board.
never heard of a surgery where you have to do something afterwards that is going to, it makes no sense. It is inane. Now, I'm not saying it might help, but maybe the patients are I don't know, making it a bigger deal than what the doctor said. But if the doctor says to you, if you don't wear the foam, everything's going to be destroyed, they're absolutely lying to you too. But you can definitely hurt it. I mean, the garment can hurt your results.
Yeah, and if you wear a
if not worn
foam
appropriately.
board,
Yeah.
you can mess up your results too. So at the end of 6 months, whether or not you wore compression should not have any difference in the positiveness of your outcome, but it could definitely be a detriment to your outcome if you have inappropriate use of compression. Let's put it that way.
Yeah.
Something that can happen too with compression, we see this not even with liposuction, like something like a facelift where someone does swell a lot after surgery, but they're wrapped really tightly. You can almost get like a little rug burn from being wrapped. Like it can cause tiny abrasions. So compression is great. Wear it however your doctor tells you to, because you chose this doctor and you trust him or her.
You always go to him.
Yep. So you trust their results or trust their advice.
Yeah.
Final results are typically seen in
3 to 6 months. Yeah. One thing I wanted to say is that after liposuction, you will definitely drain fluid.
Not everybody does though.
Okay.
There are rare people who don't.
Okay.
Yeah.
You're going to drain fluid. All right. And
You're
then
gonna leak everywhere.
Everywhere. And then everyone's going to say you're dying and you're bleeding out of the holes that were, created for liposuction. And that's not the case. A little bit of blood and water looks like blood. And the stuff that comes out is blood tinge usually.
It is. It's really pink. I always tell people, though, and I tell your caretaker this as well, like you will know the difference between what is this normal leaking fluid and what is blood, because they do look very different. And I think most people kind of understand that. So there's a definite difference between how this fluid that's coming out is in its viscosity and its texture and its color versus blood. Yeah. And you'll know the difference. And I think most people intuitively kind of know when you cut your finger how thick blood is.
Especially with me. We noted this when we were doing...
when you wouldn't... Well, let's get checked.
Let's get checked.
It was like there was a massacre in there. I came in one morning, there was
the blood was so thick.
Lancets everywhere.
I was like, I couldn't get the blood out. I can't get the blood out.
You do need a lot of blood for Let's Get Checked.
You do, but most people, I think it was fine. It's just my blood was a little thicker.
And you clot fast too. So there's a difference.
I'm an expert clotter.
He's a master clotter. Yeah. You'll know the difference, but definitely plan on leaking. And how much you leak is somewhat, again, based on you, the type of liposuction you had, the skill of the person doing it. Not that is good or bad one way or the other, just meaning how aggressive they were on your liposuction is going to change how much you drain. Some doctors put drains in. Sometimes we put drains in. So I would agree with that you should expect some leakage for sure. Don't wear your cashmere sweatsuit to surgery. Wear something dark colored. Maybe don't get in your husband's brand new car right after. Oh, yeah. Throw down an old towel.
I had some dude tell me that before. I was like, I'm really not caring about this. How's your wife doing?
She goes. Yeah.
I don't care about your
all over
Lexus.
my Ferrari.
Yeah. All right.
So let's talk about complications and other considerations.
Yeah.
We've touched on a lot of these, so I won't spend a ton of time on it. But number one, liposuction, not a weight loss procedure.
Everyone thinks it is.
No, it's not.
When they, what are you, a plastic surgeon? Oh, you do liposuction? Is that a good way for me to lose weight?
Yeah.
Everybody says this.
As regardless of your weight. So we can take a woman who is 5 foot tall and 102 pounds, do liposuction on her, and in her mind, she thinks she's going to lose 5 pounds.
Right, and everyone's stuck in the scale. It doesn't even matter what the scale says. By the way, when I do big tummy tucks, that's maybe 3 or 4 pounds of tissue that we remove.
At most. And
that is a massive amount. So maybe a couple pounds at the most with aggressive liposuction, but you're removing subcutaneous fat, which is equivalent to 20 or 30 pound weight loss if you were losing all that amount of fat all over your body. Yeah, you're just taking it out in one area.
You're spot reducing.
Yeah.
Yeah. So this is the one way you can spot reduce. This is outside the gym. This is how you spot reduce. Technique is extremely important. And I actually got this next sentence from a website specifically talking about liposuction that I thought was super fascinating.
Was it a plastic surgeon's website?
No, it was a website that I found from the Klein website, but it wasn't the Klein website. But it said the skill of your surgeon is the most important determinant of your outcome, not technology. And I have said that on so many podcasts. Yeah. So I love seeing that.
And we're like the technology office.
Yes. Yeah. And really the biggest concern with your liposuction is the skill of the surgeon, because as we mentioned, liposuction is aggressive. It's in an area where there's other stuff.
There's something we always say, search for a surgeon that is, I can't remember what it is. Search for a surgeon that is
board certified.
Board certified? Did I get you? Yeah. I was like, I don't know what it is. That's all we say. Every time I listen to these podcasts, it's like, is board certified? We should just, the podcast should be board certified.
Board certified plastic surgeon. So that's, really.
And they're board certified in something that's not plastic surgery. That's not really helpful for liposuction, by the way.
Correct. Yeah. Pain and swelling. Those are things you should expect. But
that's pretty disappointing, Nils. How could you not get that?
Board
a little
certified.
Sleep today. Yeah.
Every episode.
Yeah.
Need for additional surgery, and this is a big one. Even the most skilled surgeon doing liposuction, there may be the need for touch-up procedures. So that's a conversation that you should have with your surgeon prior to surgery.
Because sometimes you got to put your thing down, flip it, and reverse it.
That's right. Yep. I mean, touch-ups need to happen for a lot of reasons. I mean, We are dynamic creatures. Things change. You may gain or lose weight. Whatever happens.
It happens.
Touch-ups need to happen. So, but there's also, need for additional surgery could be anything that you need after this. So always know that anytime you're having surgery, one of the risks, one of the complications is need for additional surgery.
And then you should ask the office you're going to, what is the touch-up fee? Mm-hmm. Really inquire about that. If I need more surgery, things need to be touched up, how much is that going to cost me more? Yeah. Empower yourself, find out, see. And also,
there's a difference between a touch-up and just wanting more liposuction.
And by the way,
not the same.
If you are searching for a liposuction surgeon, someone who really has talent with that, look at their before and afters. Really see if they're a good fit. See if you like the way they're contouring the body. Kind of can offer you what you want in terms of results.
Yeah. Yeah. So just as one little note on this touch-up thing, you not being the size of person you want to be after your liposuction procedure is not a complication. That is an expectation.
Right.
So there's a difference between a touch-up for something that truly needs to be touched up because
Like
there's a
that's-
small asymmetry.
Like asymmetry, yeah.
Right. You just not feeling like you're small enough or the size you thought you might be after your liposuction procedure is not a touch-up.
Right.
So, yeah. I feel like such a downer on this episode.
I know, it's
All right.
terrible.
Let's look at some before and after
Let's
pictures.
get positive.
Yes.
But unfortunately, the podcast people can't see it. So
They
how
can't.
would they see these before and afters,
So
Amy?
all of these pictures, I think, without exception, are on our Instagram page, Jason Martin MD on Instagram. You can also watch us on YouTube.
I mean, just watch it on YouTube.
Yeah. And those are timestamps. So if you want to find out exactly where we start showing these pictures, just look at the timestamp, click on that little blue number, and it'll take you directly to here.
Right.
You're at Now. Do you know what that movie is?
No.
This is Now. That was then. Go back. Can't go back. Why not? It just passed. When?
Right.
Just now. Nils knows.
There's this new show, Loki, on Disney. Have you watched it? When he goes down and the guy's recording everything he's said in his life and he keeps on talking and he just keeps grabbing more pages and putting it on the stack. You can see that Loki finally realized, I just need to shut up here. This is going to keep on going forever. Sorry, go ahead.
So
Please.
this is Now. So this is an awesome. This actually was with face type, but this is liposuction of the chin.
So for those not watching, we're showing before and after result of face tight along the jawline and below the chin. You can really affect the jowling, which is that fat that hangs over your jawline. You can really remove and reduce this selfie fat and tighten the skin at the same time. That's the benefit of face type.
Well, I think really the benefit of liposuction on the jawline is how it actually helps a person look younger.
Right.
So if you look at this picture, this woman was in her 30s and she looks much older in her before picture than she does in her after. And part of that is just because that definition of the jawline is definitely a sign of like youth and health. You know, as that starts to become muted is typically with age, but you see in some people it's just premature. So she had premature kind of jowling and aging of that area. Doing liposuction along the jaw just brought that jawline back up and really helps her look younger with just a quick 45-minute lipo procedure.
45-minute procedure,
Yeah.
awake, walk in and out of the office, a week or two recovery.
Yeah, and you look 10 years younger.
Drop the mic.
Right?
Yeah.
This one is also one that when I tell people this person's age, they're shocked. So this is liposuction of the flanks with body tight.
So she's showing the patient is standing away from with her back to the camera. And you can see a view basically right above her butt to her head. And what we're looking at is below the bra line and above the hips,
Yeah,
which
so
we call the flanks.
she still has bra fat. That area was not treated.
Yeah, we didn't
So
treat the bra
We
fat.
just treated her flanks. The difference is just remarkable and something that I think people don't
I mean, that's
appreciate.
inches.
Oh my goodness, yeah.
I mean, if she was a 36, now she's like a 32 or something.
Yeah, her pants are a lot looser.
Yeah. And I think didn't she say that? Like she was refusing to buy new clothes. So she was,
No,
Okay.
no,
No, she
not
had
this
to-
patient.
okay.
Maybe somebody else.
in my mind, that's what she did.
No.
And she was like using paper clips and stuff.
No, this patient was not. Something that I love showing with the flanks is a lot of people think that they need liposuction on their abdomen, which in a lot of cases is true. However, this patient, when she came in, I said to her, I'm like, you really actually need liposuction on your flanks.
Yeah.
Like you've lost your waist because your flanks are big, not because you have fat on your abdomen. She had fat on her abdomen from pregnancies and just from other things that really needed a tummy tuck more than lipo would help. I mean, even she was shocked. Like people don't always think of like where it isn't,
Yeah.
you know? Like I hate my stomach. Well, hey, if we lipo your flanks, your waist is going to look super tiny.
Right. And then your stomach's not going to be as obvious.
Right.
Yeah.
Then your
So
pants are
true.
going to be better, everything. Yeah.
That's a remarkable result.
And this woman is in her 60s.
Yep.
Yeah. Has amazing
In the
skin
office
integrity.
under local anesthesia, an hour and a half.
She was talk about a tough lady. Like whew.
And I was sweating in this
Down on
case because
her.
I was
Yeah.
definitely.
Yeah,
Yeah.
this was a big one. This is what I was talking about before, where someone just had really unusual fat deposits in one area, and it's on the arms. It's almost unbelievable that this person did not lose weight in between these two pictures, and she did not.
She did not.
She also is an avid tennis player, so she is extremely active. She is a normal body weight. Her BMI is perfectly normal. Super active, plays tennis multiple times a week, is in tournaments, and just had, as you can see from this picture, like a
Yeah.
lot of fat in her arms.
Proximal arms between the shoulder and your elbows is an amazing place to do liposuction, specifically with body tight. And this was an in-office case, awake, about an hour with body tight.
My favorite story about this patient, I love talking about patients just because we have such great relationships with them, was that she ultimately ended up having a tummy tuck, but did the lipo in her arms first as like her, like to see if she liked you.
Oh, yeah, people do that all the time.
Like, I'll let him lipo my arms.
It's kind of like, you know, if you're on like one of those dating sites and you want to meet the guy at the coffee shop. Yeah. Mm-hmm. That's like what these beginning lipo cases are. And they're like, oh, that guy is really good.
Incisional surgery is like your first weekend away.
Maybe I'll go to dinner with him now. Maybe I'll do a tummy tuck with him now.
Yeah. So, I mean, it really shows, though, the versatility of liposuction, that you can treat, as we talked about, so many different areas. Even though it's not weight loss, these people look better, they look younger, they look more how they feel, you know, and without, none of these people did liposuction to lose weight or wanted to lose weight. I mean, that was not the goal for any of them, but getting, you know, the contour to where it is actually, you know, matches the rest of your body is really
that's
amazing.
The last thing I'll say. I mean, we could talk for liposuction for hours, but I think we really covered everything. Good job on the stuff. I do think that liposuction is primarily made to remove small pockets of fat that won't go away with diet or exercise. But the lipocontouring part, like how you approach it and the technique, really is dependent on the surgeon. Someone like me who does these cases every week, you can see me sculpt it. I mean, I see it myself. I mean, you're sculpting the body right in front of you. It's just almost remarkable. So there is like baseline liposuction, and then there's like really like lipocontouring liposuction. And I highly suggest that you go to someone who does that kind of lipocontouring thing. And you know it when you see it. You can see these results and see the contouring, the artistic eye. It's a lot of artistic eye stuff with liposuction more than many of the other procedures we do. And that's why I love it. If you go to and do basic liposuction, it's going to be better, right?
Mm-hmm. Or debulking. Like there are doctors who do debulking.
Yeah. There's nothing wrong with that. But I just... My suggestion to you is just to find someone who is like me, passionate about contouring, lipocontouring with liposuction, and preferably with some sort of energy device. But that's just my opinion.
Yeah. If you do have more, if you want to dig deeper now that we've talked about liposuction and you haven't listened to our episode where we talk about fat, it's really great. We talk a lot about the functions of fat in the body, other types of fat removal techniques, and it gives you a little bit deeper look at like how fat functions in general. And
we're not even getting into using the fat that we remove, which we'll get into that later on.
This is all fat transfer. This is just liposuction.
Just removal.
Yep.
There's a whole nother layer. We're not even picking up the sheets yet, Amy. We're on top of the bed.
Wow. So with that said, Dr. Warren, I did not put this on a slide, but I feel like we must mention your ever famous saying about liposuction.
What do I don't have any idea.
Oh, you know.
I don't know.
To an awake patient.
Oh, don't worry, it's not hurting me?
Nope.
Okay.
If you suck it up, we'll suck it out.
Oh, if you suck it up, we'll suck it out. I actually learned that from a nurse. Yeah.
Yep. Oh, she was called her Tinkerbell on steroids. Yeah. Like she was intense. So
you suck it up, we'll suck it out.
Yeah. That's really, that is the story of liposuction. It's going to be one slide. That is the story.
You're going to suck it up and we'll suck it out.
Mm-hmm.
Let's go.
You're going to swell.
No pain, no gain.
Throw in the trash. We're done.
Yeah.
All right. Well, thank you everyone so much for listening to this episode. Really do appreciate it.
102 episodes to get to liposuction, one of the most common procedures in plastic surgery. We're pretty deficient when it comes to what we're doing.
So if you would like to leave me a voicemail or send me a text, it's this way, right?
This way.
This way?
It's this way.
It's this way. The phone number is 303-630.
I think actually people are leaving you voicemails, which is amazing. So I want to thank everyone for doing that. We love voicemails. It's a little embarrassing because Amy seems a little bit desperate with the voicemail situation.
Not anymore. People are leaving them. So it's 303.
Oh, so you're getting a little cocky now.
I am. 630-9038.
Okay.
If I don't say the whole number, no one can call.
No, let me say it for you because I say it, but I have a more radio voice. 303-630-9038.
Yes. So thank you so much, everyone, for listening. If you like this podcast or found it helpful, we would love it if you would leave us a comment, a like, a rating, review, share us with your friends. All that stuff really does help. It makes a huge difference in the algorithms out there as they may be.
Yep.
So thank you so much for listening. We will see you next time.
Thank you so much.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.